Hi, this is Dr. Lisa Lilienfield from Kaplan Center for Integrative Medicine. Today I want to discuss the functional medicine approach to migraines. First of all, I start with the history through the ATM lens. ATM stands for antecedents, triggers, and mediators. Antecedents to migraines can be, for example, a genetic propensity to migraine or something acquired, such as a head injury or maybe a birth injury. A trigger can be something like a food trigger, such as red wine, aged cheese, fermented foods, or barometric pressure changes, dehydration, stress, or sleep disturbance. A mediator is something that keeps the migraine recurring or prolongs the migraine, such as nutrient deficiency, food intolerance. So once we've taken the history through the ATM lens, then we go through the whole functional medicine approach. First, looking at digestion and assimilation. Diet is extremely important, and the function of the gut is of utmost importance because there is a gut-brain connection, and 75% of our immune system is in our gut. So we can do a digestive testing, and or we have our patients see our dietitian Nor, who is fantastic. Then we look at could there potentially be an infection such as Lyme disease or reactivated Epstein-Barr virus, or could there be an autoimmune disorder? We look at environmental toxins. Mold toxicity is very common and can lead to migraines. Heavy metal toxicity could lead to migraines. Looking at hormones is also very important, such as thyroid function, our reproductive hormones we can look at as well through testing. There could be a structural issue, such as a cervical disc or a temporomandibular joint condition, or hypermobility that can all contribute to migraines. We look at lifestyle factors such as sleep disturbance, lack of exercise, or dealing with how we deal with stress. So all of this contributes to how we look at the condition of a migraine in a functional medicine approach. It's complex, but it's necessary because we really want to look for the root cause as opposed to just identifying a symptom and writing a prescription for it. When a patient comes in and I take the ATM history, go through all those factors I mentioned in the history, I'll often start them off with some supplements such as magnesium, riboflavin, CoQ10, and quercetin before we go through any further testing, which is quite easy. Now we use medications. There are rescue medications for acute migraine. There are also preventative medications. In the last couple years, 2 or 3 years, there's been a breakthrough in a type of preventative medication and now a rescue through these calcitonin gene receptor blockers. And we've had noted that our migraine patients really respond in that their migraines frequency and intensity are reduced. So we will still use medications, but we also explore all these other factors and try to reduce the frequency, intensity, and maybe even get rid of the migraine if we can look at all of those other factors. So it's a very intensive detective work that we explore through functional medicine. So in the future, I will discuss other ailments or conditions through the functional medicine lens. Thank you.